But I think it's also a matter of just like how much you want it. If to become a doctor, you have to be very passionate about it. You're going through so much schooling. You have to know exactly what you want to specialize in, versus not that you aren't passionate when you're a PA or an NP, but you have a little bit more flexibility in terms of like lateral movement and can switch specialties if you change your mind later in life.
On this week's episode of the ASCNSN Studio Podcast, I had the pleasure of sitting down with Haley Fitzgerald, who is a physician assistant with Global Neurosciences Institute. Haley is a board-certified physician assistant specializing in neurosurgery. She also has previous experience in an urgent care setting. She received her master's degree in PA studies from Temple University's Lewis Katz School of Medicine. She received her bachelor's of science degree in behavioral neuroscience from Lehigh University. Her other training and certifications include the National Commission on Certification of Physician Assistants, the Advanced Cardiac Life Support, Basic Life Support, and Advanced Stroke Life Support. Her professional memberships include the American Association of Neurological Surgeons, American Academy of Physician Assistants, and the Pennsylvania Society of Physician Assistants. I hope you enjoy this week's episode and want to thank Haley again for taking the time to sit down for the podcast. This is the first official ASCNSN Studio Podcast. I'm trying to come up with a better name, but that'll go down the road because I know it's spelled in an interesting way. But yeah. I'm sitting down with the wonderful Haley Fitzgerald, who
thank you for having me.
Is a PA at Global Neurosciences Institute. So welcome. Thank you for coming on the podcast.
Thank you.
And why don't we start out with a little bit about yourself, background and
Sure. Yeah. So as you said, I'm a PA. I grew up around here, so around King of Prussia, Pennsylvania, and moved into Philly for my PA training, and now I'm kind of residing in Conshohocken, Pennsylvania, and now working as a neurosurgery PA. So, besides spending my time working, we just got a new dog. I enjoy running, reading, so everything's been great thus far.
So how did you start out, not start with like going all the way back, but becoming a PA, how does one start, but how did you get into that? Did you start out with, interested in the sciences or wanting to help people? Like, where did you find your calling to want to become a PA?
Yeah. So a PA or a physician assistant, if you don't know, is a healthcare provider that basically is able to do a history and physical and diagnose and treat patients underneath a supervising physician. I didn't always know that I wanted to be a PA. I basically was interested, as you said, in the sciences from a pretty early start. So in high school, I knew I was always interested in the science track. And then when I went to an undergrad, I kind of found that I was more, geared towards like the actual patient care aspect of science. So I majored in behavioral neurosciences at Lehigh University and knew that I wanted to go into a healthcare profession, but didn't really know what. So, everyone always thinks automatically, like, do you want to become a doctor? And for me, when I was thinking about where I saw myself in 5 or 10 years, the amount of time and schooling and money that it took to become a doctor just didn't seem like it aligned with some of my, future goals outside of work. So I was a little bit intimidated by that path. And when I started learning more about the PA profession and advanced practice providers in general, that was kind of like it clicked for me because you could do the patient care and you could see your own patients, but it was almost like a fast track type of way to, do that. So basically, you didn't have to go through as much schooling, and you don't get as much like autonomy and some of the responsibilities as a doctor, but you can still care for patients and do a lot of the other like small procedures and things like that on a day-to-day.
Yeah, with medical related stuff, or just being a doctor in general, I mean, it seems with the amount of schooling, like you said, cost, you have to almost know, like in ninth grade or
Yeah.
even middle school, like your prerequisites, right? Like
Exactly.
with biology, or, I was a terrible student in general, but like that kind of, if I wanted to become a doctor, I would have had to have gone back to square one. Whereas maybe some people know they want to become a doctor from a younger age or go on these fast track programs. So it's an interesting educational path.
Yeah. And I think that if you want to be a doctor or a PA or an NP, there's always, it's never too late to decide you want to do that, because you can do the prerequisites later in life. And say like you went to school for like English or something that's even outside of the sciences realm. As long as you take the prerequisites you need to apply to these schools, and you'll be okay, and you'll still be considered to go to PA school or to med school. But I think it's also a matter of just like how much you want it. If to become a doctor, you have to be very passionate about it. You're going through so much schooling. You have to know exactly what you want to specialize in. Versus not that you aren't passionate when you're a PA or an NP, but you have a little bit more flexibility in terms of like lateral movement, and can switch specialties if you change your mind later in life.
Mm-hmm. So I feel like I didn't do a great job starting out. So a PA is physician assistant. And then you said NP.
Yep.
Nurse. So if you could explain the general, there's obviously doctor, we all know what that is, but some of the other medical terms that people might hear about and be like, I don't know what that, like I thought PA, I'm like public announcer, like MA, I don't know, state of Massachusetts, but so what those titles might mean.
Sure. So yes, PA is a physician assistant, and NPs are nurse practitioners. A lot of times we get lumped together because we are advanced practice providers or mid-level providers, if you'd like to say. And basically, it depends on what specialty you're in terms of the differences in responsibilities. But in reality, there's a lot of overlap, especially in neurosurgery. In my day-to-day, I'm doing the same thing that an NP would be doing. But the main difference comes from the way that the training goes. So for a PA, you have to have an undergraduate degree and the prerequisites that we were talking about. But then you also need to have a certain amount of patient care hours before you're even considered as a PA school candidate. And that just means that you need to have contact with patients before going to school. So you can do this as an MA or an EMT or really anything that allows you to have face-to-face time with patients. And you would need like 500 to thousands of hours to apply to schools. And then NPs is more of like the nursing model where you become a nurse first before going to NP school. And there's differences even in a day-to-day, this is just ever-changing. Some people are going straight as like almost a combined program with to become an RN and an NP, so you just go through both schooling straight, versus some people that work as an RN for years before deciding that they want kind of that more responsibility and more patient care aspect as an NP later in their career.
Okay.
I don't know if that answered your question.
No, it did. Yeah, it's my goal as well. And I think at this point we're recording, but I will have put out a video explaining exactly what this podcast is and why I started it.
Yeah.
But it's to really help out audiences who might be interested in this topic. So like the beauty of this podcast is some people might say, you know what, the medical stuff, I'm not really interested in this. Like we have a guest coming on next week who's going to talk about the food restaurant industry. They might be interested in that. But I know hopefully there are a lot of people out there listening, and I've seen on social media that are interested in the healthcare field, but they're like, being a doctor, that sounds like a lot, or says maybe, do I want to be a nurse? Do I want to be? So I think that helps. But what advice would you give to somebody that might be confused? Let's say maybe they're in high school right now, or they're going into their senior year, they're thinking about college. Or if they're interested in the healthcare profession, any tips you might give them to consider?
Yeah, so I think the most important thing to do would be just to gain exposure in general. And this is something that when you go to an interview for a PA school or a med school, that they look to see how much exposure you have to kind of gauge how much you actually know about what you're getting into. So even in high school or in college, you can just reach out to even your own provider and your primary care provider or specialist that you're going to, and ask them just to shadow them for a day and see if you could see yourself fulfilling that role and see yourself, not only seeing patients but living that type of lifestyle, because depending on what specialty you're in, it can take a lot of time. Like if you're in neurosurgery, you might have to take call, you're going to be in the OR. So that's just something to consider in terms of a day-to-day and where you see yourself. I think that you can do that no matter what type of healthcare profession you're trying to decide on going into. Just reach out to somebody that you may know that is one and ask them questions and follow them around a little bit.
Mm-hmm.
That would be my advice.
That's so to quickly segue into, I'm going to bounce around all over the place here as I get used to being
I'm trying to make sure I cover everything.
Podcast host, but I know it's I wanted to have a list. Like I know a lot of podcasters have computers and tablets in front of them. The problem with this, I'm still experimenting, is if I have my computer here, we have two cameras. This is blocking this one. So for the people that are listening on Spotify, they can't see what I'm talking about. So it's a good reason to check out our YouTube channel. Yeah. We do have a video component to this. But before I was going to jump into something. Before I get to that, so you kind of explained, your track where you went to Lehigh. And so the first thing is obviously go to elementary school, you go through middle school, you go through high school.
Yeah.
And then you go to undergrad. And then out of there, you go to PA school?
Yeah, so it depends. For me, I took some time in between undergrad and PA school just because I didn't know that I wanted to be a PA until late in my undergraduate career. So because you need so many patient contact hours and the prerequisites, like I had to go back and take some more classes even after I graduated from Lehigh, because they didn't offer anatomy and physiology at the time, and I didn't take like microbiology or medical terminology at that point because it wasn't a part of my curriculum. So a lot of people will take time off in between just to make themselves more of a competitive candidate for school. But yeah, generally it would be undergrad and then get your application together and then apply for PA school. And those applications, at least when I was applying, opened up every April. And then the interviews were just kind of based off a rolling basis. So you could just randomly get any interviews throughout that next year before the classes start.
Okay. And is PA school is just, not generic, but you're talking about specializing, like you are a neurosurgery PA. So yeah. I assume for every type of medicine, there's a specialist for PA. Do they cover everything in PA school or?
Yeah, so the PA profession historically was built because there was a doctor shortage, and it was mainly geared towards primary care. So you can still see that in the type of education model we have now, because you have 1 year that's didactic, which is basically you're sitting in a classroom maybe like 6 to 8 hours or more a day, learning everything in every single specialty. I shouldn't say everything, but basically an overview of every specialty, and that can be, how to diagnose and treat certain illnesses. It goes into depth in each section. So you can have a cardiology section, neurology section, emergency medicine, and all schools are kind of designed differently. But that year you have a general overview, and then a year plus you go into rotations. So you also see all of the different specialties at that time. So you graduate with a general knowledge of all specialties, but during rotations, you can kind of gauge what piqued your interest the most, and that's typically where people will start. But you're not stuck in one specific specialty. So I started in urgent care, and worked there for a year, but I've always been interested in the neurosciences. So after a year there, I kind of, figured out how it is to work as a PA, and I just kind of realized that I wanted to go back to those neurosciences, my neurosciences roots, and then applied here to become a neurosurgery PA.
Okay, yeah, I was about to ask how you made that segue, but if you were interested in neurosciences, that makes sense.
Yeah.
What would you say, is there a connection between neurosciences and neurosurgery? Because I feel like those often get grouped together. Like, oh, it's the brain. Like,
yeah,
there's research. What is neuroscience research, and then neurosurgery is just the operation? How would you?
Yeah, so I mean, it is all related. My undergraduate degree in behavioral neurosciences kind of went into depth on like the molecular aspect of the neurosciences. So kind of like on a cellular level. That's just a foundation of knowledge you need to know for any type of biology and neurology and neurosurgery. So it's all interlinked, but yeah, you need to, neurosurgery is a subset of the neurosciences that you need to kind of go more into depth in terms of education to start out on a career path there.
Mm-hmm.
That was just like, I don't even know what I was saying.
That was, so what does a typical day look like for you as a neurosurgery PA?
So I work outpatient. So I do a lot of the patient management in the perioperative sense. So that's pre and post surgery. So I can see my own patients, which are mainly follow-ups from the hospital, new neck or back pain that doesn't have images. So, someone that needs to start a workup, or patients that have recent strokes. I can see them on my own under the supervision of a doctor and kind of come up with a treatment plan for them. And then on the flip side, we also have treatment teams where we're paired with one of the neurosurgeons. And so we participate in their clinic, and we will see the patients with the neurosurgeons and do, kind of work them up and do a physical and interpret their images to see if they're candidates for surgery. And then I specifically will do a lot of their pre-admission testing workup before they actually get surgery. So they'll have labs done and, chest x-ray, EKG, just to make sure they're medically optimized for surgery. And I'll review them, make sure everything looks good, talk with the patient, kind of go over what to expect. And then after the discharge from the hospital, I'll start their care again because I don't go inpatient. We have a whole separate team that does the inpatient care. So when they come out of the hospital, I'll do like their wound checks, make sure there's no infection, and make sure that the incision is healing properly. And then we'll see the patient back in the office after like a 4 to 6 week period with the neurosurgeon and I, and we'll kind of go over, how they're doing and what the follow-up process looks like.
So when you're assessing like the wound care and stuff, so are you actually at the hospital doing all that, or is that afterwards, like an outpatient office?
Yeah. So all neurosurgery practices kind of vary in terms of their division of what PAs will do. Some practices will have PAs that'll do both outpatient and inpatient work, but for us, I do only outpatient. So I won't. I could go into the hospital with the neurosurgeon that I work with, but I do mainly my responsibilities are outpatient. So I'll see them in an outpatient office like 2 weeks after surgery, and they'll come in and I can clean the wound and make sure that there's no increasing redness or drainage that would be concerning for infection there.
So you must, to know all of that, have to know a lot about the human, anatomy and stuff, I imagine then, right? Like,
yeah.
For what was covered in PA school, very extensive to, you're working with human lives. You're entrusted with a lot to, you might not be performing the exact procedure, but you might catch things that the doctor might not necessarily see, or if somebody is going in for an x-ray and they have a metal plate they forgot about, to catch that and to really, so it seems like, correct me if I'm wrong, but you guys are big advocates for patients, or that you work very closely with the patient to make sure they're having the best experience at the hospital.
Yeah, I think that's one of the things I love most about the PA profession is that we have a little bit more time to spend with the patients. So going into something like brain surgery or having surgery on your spine, nobody's comfortable. Nobody's excited to have surgery in general. People are generally in their most vulnerable states. So it's nice and fulfilling to be the person to kind of walk them through the process and to be available, mostly at all times to, answer any questions or concerns that may have leading up to that process, which, as you can imagine, neurosurgeons are very busy people. They're in the OR. They're, doing a load of things that they might not be able to answer your call at any point of the day. So it's nice to be that, comforting and be that support system for the patient throughout the whole process.
Does every doctor have one PA? Just sometimes they have two PAs, or is it always like one PA, one doctor, one PA, one doctor?
It depends on the practice. For us, on the outpatient side, it's 1-to-1. But you can imagine the legality, I think that one doctor can have two underneath of them, because you want to make sure that, it's not like they can have like 10 PAs that they're taking or they're overseeing, because that would just be too many patients that they would have to make sure are being treated properly. But yeah, it can vary depending on the practice in terms of how many PAs there are, or one PA can cover multiple doctors. So they can, review imaging or take patient calls for more than one doctor as well. So it can go both ways.
Do you have any memorable stories with patients that you kind of, during a rough day, you might think about, or like, this is really why I am a PA, or this is really, a unique circumstance? Obviously, with the HIPAA and medical stuff, we're not going to give out all the patient stuff, but just anything working with patients, maybe talk about what that experience is like.
Yeah. So, we have a lot of patients that are very grateful because, like I said, they are very scared throughout this whole process. We had a patient recently that had to get a shunt put in, which is basically a device that drains the CSF or cerebral spinal fluid into the abdominal cavity for your body to absorb if you have too much fluid on the brain. And as you can imagine, they were very terrified for this to be done. And I just saw that in her. She was just very apprehensive. She had family members who, had extensive medical history and ended up dying at an early age in a hospital. So she didn't even want to go into a hospital in the first place. So I just reached out to her a little bit more than I would maybe a normal patient, because I saw that in her. And, everything went well. And afterwards, it was just gratifying for her to come into the office and be like, she was just very grateful and thanked me for, almost holding her hand through this process, because she didn't have a lot of a support system at home. So that, I went home and felt good about the daily work that I do, because to see that is just makes it all worth it.
Yeah, the patients are trusting you throughout the whole process. From the jump, you're telling them, we're going to get through this. I'm not a PA, so I can't say what you would say, but like, I imagine you'd say, like, it's going to be, we know what we're doing, and it's all going to be okay. And we've done this before. I think there's something comforting about knowing that, and at Global Neurosciences, I think that's, you guys have done so many different cases. So.
Yeah, exactly. And it's nice as a PA at GNI, because you're working alongside of some of the experts in neurosurgery, some of the best neurosurgeons in the whole country. So it's nice to work alongside them and not only learn from them, but to have the comfort in knowing that patients are, in the best hands that they possibly could be for these procedures. So it gives us confidence to be able to say, look, you're going to be, you're in the best hands, and this is like the best place to be for this procedure. So we'll help you throughout the whole process.
Yeah. Do you interact with other PAs, like either at GNI? How many PAs are at GNI?
So we have both PAs and NPs. So APPs, or advanced practice providers, we have, I think I'm probably going to say this wrong, but I think we have like 5 outpatient, and then a slew inpatient because we have APPs for both neurology, neurocritical care, and neurosurgery inpatient in multiple hospitals. So that's just ever changing. I think there's probably at least 5+ inpatient, 5 to 10 maybe.
Okay.
Mm-hmm.
Do you interact or on a day, like if you are outpatient, do you interact with inpatient or maybe, with company-wide stuff, or is it like you rely on other, I guess the interaction just between PAs? Do you rely on other people like, hey, I need this from your doctor. Could you send this to me?
Yeah.
Or stuff like that?
Yeah, so it's a lot of that. And it becomes specifically important when patients are in the hospital and we're trying to transition their care from inpatient to outpatient. So, we all are friends and we hang out outside of work. So it's very easy for them to call me or me to call them and say, hey, so-and-so was in the hospital. What do they need? And, easily communicate so that nothing's missed along the way from that transition.
Mm-hmm.
But yeah, so I interact with everybody or all PAs and NPs pretty regularly, both outpatient and inpatient.
Yeah. To segue into a more personal aspect, how do you balance? Because I imagine working in a hospital setting can be difficult, but how do you kind of balance that with your own personal life? You said you have a dog, who I have not met yet, but Douglas the Golden. I have a Golden myself, so they're
the
great
best.
dogs.
Yeah.
But what do you do to kind of, reset and I guess schedule-wise too, and I'm asking a bunch of questions here, but on weekends, like, do you work Monday, Friday, and then you have Saturday, Sunday, or is it like your schedule can be all over the place at times? What does that look like? Yeah,
so it also varies inpatient, outpatient. Me specifically, in the outpatient setting, I work Monday through Friday from 8 to 5 every day. So in order to kind of, set the boundary and kind of reset on the weekends, I usually, try to make sure to kind of disconnect a little bit, try to get all of my work done during that time frame. And don't get me wrong, like I still will, answer a call or an email outside of work, and that's just kind of how the outpatient life is. But I'll make a point to, do things that I enjoy doing, like playing with Douglas or, going on a trip or like traveling and taking time off when needed. And I think that helps because, you do care so much about the patients that we see that sometimes you can almost get too involved emotionally, and that can lead to burnout in any type of healthcare provider. So making time to kind of just take time for yourself and de-stress is vital.
Speaking of stress, what would you say is one of the most stressful parts of your job?
Yeah, I think that's a good question. I would say, I think just we're the front lines basically when any patient has any type of issue or question or concern. So, we get the calls when anybody is having any type of complication or they are concerned about a certain symptom. So it can take a lot to kind of work through what complaint they're coming at you with, and you have to really take a lot of time to process it mentally and come up with a differential diagnosis and rule out anything life-threatening, especially in a neurosurgical population, and decide what needs to be escalated to one of the neurosurgeons. And that whole process of kind of triaging patients can be the most stressful at times because you want to make sure that you're not missing anything that might need further evaluation emergently.
What does that mean, triage? I've heard that a lot,
Yeah.
but I'm always like...
So you kind of do it on a daily basis as a healthcare provider. It's really just trying to determine the acuity of a patient. So whether if they have an emergent problem that probably needs to be seen in an ER and get workup right away, or whether they have something that can probably be worked up outpatient, or whether, maybe their issue isn't related to a neurosurgical diagnosis at all. You have to kind of decipher who needs what at what time. And basically that just takes a lot of multitasking on all of our parts to say, this is what I need to spend time on first, and this is who I need to speak with the neurosurgeon about right away and give them a call.
Mm-hmm. Yeah, it seems like a lot of detail, the depth of this, where a patient, I've never had brain surgery, but going in, I've had knee surgery, you see everything that is done for you. Like you go in for pre-op, you sign some papers, and you kind of go under anesthesia stuff, but you don't really realize as a patient how much stuff is going on behind the scenes. And up until COVID, I feel like people really took for granted what you guys do. Were you working during that COVID time?
Yeah, so I was working in urgent care during COVID, so
oh, wow,
it was very crazy.
That must have been an experience.
Yeah, so, I mean, in a way, it was kind of good because it eased my way into the types of patients that I would see out of school, because a lot of it was COVID and COVID testing. So while I had to see a higher volume of patients and upwards of 70 patients a day on my own in a 12-hour period, a lot of it was COVID testing, and it didn't require as much of as much of a kind of coming up with that differential for every single patient. So as COVID kind of eased out, we started seeing more patients come in that were a little bit different. So people were less afraid to go to an urgent care. So now they were coming in with other things like a rash, or if they got cut, we could suture them up in the urgent care. So it was kind of a nice way to segue into being a PA out of school. Not that COVID was a good thing whatsoever, but it's not as bad as you might think being in urgent care during that time.
With urgent care, I feel like people go to urgent care sometimes for like very minor things. What's the number one most common thing that you see in urgent care? Or maybe that's just my personality. Like, you don't need to go to urgent care for that. But is there anything where to the public that's listening, if you experience this, and we're not giving out medical advice, so don't sue us here, but where you're like, you probably don't need to come to urgent care for that, or it really depends on the person. Like if you're like, I got a paper cut, time to go to urgent care, because then does not fill up the urgent care with things where you're like, we have other stuff to get to.
100%, and it would 100% be just any type of upper respiratory infection. It's very difficult as a provider, especially when people are coming in and waiting for 30 minutes to an hour, to be told that they have a virus that doesn't need an antibiotic and just will go away on its own, is really what we see most of the time there. Because usually, people are always afraid that they might have a bacterial infection. But if you just have a cough and a stuffy nose for a couple of days, it's not really standard of care to get an antibiotic at that point, because 99% of the time it's a virus and there's no treatment for it.
You just gotta let it run its course, basically.
Yeah, you can treat the symptoms, but most of the stuff's over the counter. So, if you're having serious symptoms, of course, go and get evaluated, but I wouldn't jump to an urgent care as soon as you start coughing.
Yeah. I had two other questions, because I want to, Haley is a busy person, so I want to let her get back to her life, and I appreciate her taking the time. But I always see, if I ever do see the PA title, like PAC, right?
Yeah.
Like PA, I don't know what the other classifications are. What do those classifications mean?
So, anyone that's working as a PA is a PAC. You go to school to become a PA, and then when you take your boards, which is the PANCE, then you get certified. So once you pass the boards, you're certified, and the C just means that you're a certified PA. So really...
PA certified?
Yeah.
Oh, okay.
Yeah, exactly. So I think some places might drop the C, but really anyone that's working and providing medical care is a PAC.
I see, okay. So there really is no other class, it's just PA certified?
Well, you can be a PAS as a student.
PA student.
Yeah.
PA certified PA student. Okay.
Yeah.
So now we know.
Yeah.
If you ever see that on people's Instagrams, they're just PA certified. There's no special classification. Okay.
No.
And then how long was PA school again?
Yeah. So PA school varies depending on the school, but usually it's between 2 and 3 years total. And that's typically a year of didactic courses, so being in the classroom itself, and then over a year of going on rotations. And those rotations might vary depending on the number of weeks that you're in each one.
Got it. So to wrap up here, where do you see yourself going in this track, or what, as your career progresses, how do you advance as a PA, not just, positioner, I moved to this spot or this spot, but like, what would you, I guess a better way to ask that question is, what would you like to see improve that you're working on? Obviously you're helping patients, but what does the future of, being a PA look like?
Yeah. So one of the reasons why I love it at GNI is that I find here the supervising physicians and just the company as a whole really pushes you to find out like what you're passionate in, and they really motivate you to create projects along those lines and do something that you're really interested in. So right now at GNI, Dr. Vez and I are starting the Chiari Center, or the GNI Center for Chiari and Syringomyelia, which looks to treat Chiari patients holistically, because right now there's not a lot of Chiari providers or surgeons in general, but it often gets overlooked that Chiari patients have not only the symptoms directly related to the anatomical difference of the Chiari itself, but they also have psych and mental health issues that might be related to the Chiari that kind of get overlooked, and nobody really helps them to get treated for those things as well. So I'm passionate about the Chiari Center because we are going to have not only neurosurgeons and neurology to help manage the symptoms, but we have neuropsych here, which you don't see everywhere, and neuropharmacology and research. So we get to comprehensively treat these patients instead of just saying, hey, you're a surgical candidate, or hey, you're not a surgical candidate. See ya.
Right. Yeah. Like I've seen TikTok, ever since you mentioned, I see TikTok content from PAs.
Yeah.
This is my PA life. Or here's my rotation Google Doc sheet you can download, something like that.
Yeah.
I've seen that. I've heard, actually I have a friend who she was tracking on Instagram, her pre-PA journey. People do those types of Instagrams, but you've already done it. So to give people who are listening that value of, I've already done this. If you have questions, reach out to your provider. Or if you want to know more about GNI, you can, I'm not going to say reach out directly to Haley. You can say that if you want, but where people might look up to you as a role model, hey, I saw Haley and I saw her journey and I think that's cool. I want to do it too or something.
Yeah. I mean, to your point, I think because some people aren't as familiar of the profession, it's kind of very intimidating to apply to PA school. So there's not as many opportunities, if you don't have somebody or family working in healthcare, to figure out ways that you can shadow, or trying to get your foot into the door essentially. Like we said before, you can reach out to your providers. Yes, you can reach out to GNI if you're interested in shadowing and you feel like you might have an interest in neurology or neurosurgery in general. But my advice in general would be to just take it day by day. If it's competitive to get into in general, but if you the first year don't hear back, just continue to expand your knowledge in healthcare in general, but also the experiences you have. So, make sure that you're shadowing and volunteering and just making yourself a well-versed candidate to be able to apply and be competitive for these programs, because they're not the easiest thing to get into.
Yeah. Are the acceptance rates, depending on the school, some are more competitive than others?
Definitely.
You're looking at 5, 10, 12, I don't know what the percents
exactly
look like. But
I couldn't give you, don't quote me on it because I can't give an actual percentage. I think overall, I think the acceptance rate is 30.
Okay.
So it's not 2.
It's not 3%.
It's not impossible.
Okay.
Yeah. But they're really looking people are competitive in general these days. So people can have, thousands of patient contact hours working as an EMT or whatever before applying. And it's not to say that if you don't have that, you're not going to be considered, but, just building yourself up to stand out on paper is helpful. And that doesn't have to be in healthcare in general. If you have something that you're passionate in outside of healthcare, then pursue that and be able to talk about it, and how that might even apply to what you're doing in a day-to-day as a PA would be a good thing for, the interview process.
Yeah, I feel like you're definitely tested with, it's not doing something like me with video. I've been able to just say, I'm just going to go out on my own and just try to start this podcast, do it. Like, there's no certifications or anything. I'm just doing this, uploading it to YouTube, Spotify. I hope people enjoy it. Yeah. But for the medical route, you really have to be, tried and true, tested. But hopefully, and I feel like for most people, the reason you get into it is because you want to help people. And no matter what, even if you get, rejected or denied, or you can't find your footing at first, I think I don't know what you would say to this, but it feels like that almost, if somebody gives up that quickly at it, maybe you didn't want to help patients from the beginning. You just wanted I'm a PA, or I'm a doctor. My parents wanted me to be a doctor. My parents wanted me to be a PA. But the people that are really persistent at it. Yes.
And continue to do things outside of the PA application process to say, look, I'm proving that I want to do this by getting involved in XYZ, and still reaching out to people or getting involved in certain organizations outside of that process. Even if you get denied maybe the first time, if you continue to do that and show up next time and say, look, I did this and I still branched out in certain ways and I'm really I want to be here, then they 100% see that, and it can definitely help with the acceptance process in general.
So to wrap up, if anybody wants to get in contact with Global Neurosciences or learn more about what you're doing at GNI or being a PA in general, they can visit gnineuro.org, right?
Yeah.
Or however you would.
Yeah, it lists our contact information on there. So I think that would be a good place to start if you are interested in learning more about us or shadowing or anything. Then just call the number on there and then we can set something up.
Okay. Well, thank you so much for it. Hopefully the next time we'll have you on. We'll have Douglas. We'll bring both of our Goldens on, and they'll ruin some audio equipment here. But thank you so much for taking the time to come on the podcast.
Thank you for having me.
I hope everybody got something out of this. And if you're an aspiring PA, then Haley's the one to contact. So.
Oh, thank you.
Thank you, guys, and we will see you in the next episode.